It's wonderful to celebrate 75 years of WHO providing better health for the world. I was a teenager over 70 years ago when I became interested and wrote WHO for information, and I've followed the history of WHO since that time. And one of the great things was smallpox eradication, a terrible disease. WHO did not want to get involved in smallpox eradication for good reason. The yellow fever eradication program had failed. The malaria eradication program had failed. They did not want to get involved in a third failure. But eventually they were convinced this might work. And so a program was developed. The disease was so terrible, it's hard for us to imagine 200 million people died in the 20th century, 200 million, all in the first 75 years of the 20th century. Another 200 million would have been scarred for life. So it was a bad disease and it was widespread. Voltaire had smallpox, and he calculated that 60% of all children born in Europe would get smallpox. A third would die, a third would be scarred for life, and a third would recover. That's how bad it was. But WHO was reluctant to get involved because of the failures of the past. When they did, they developed a superb program, first looking at the vaccines that were being made and coming up with standards and simply saying they would not accept any gift of vaccine that did not meet those standards. And then they looked at the delivery of the vaccine, and the jet injector was used for over 100 million vaccinations in Africa. Then came the bifurcated needle, and it was just the miracle of so small, so light, so cheap, so easy to sterilize, and you could teach a person in minutes how to be a proficient vaccinator. Then early on in West Africa, it was demonstrated you didn't really need to do mass vaccination first. You could put your effort into finding the virus, vaccinating around it, and you could stop the spread. So WHO had intended to do mass vaccination around the world, and in fact, some of the publications, they thought they would have to do that twice before concentrating on the virus. They didn't need to do that. Surveillance containment became the approach used around the world, and it was fun to watch countries become smallpox-free. First, 20 countries of West Africa. Everyone considered these would be the most difficult places because of the poor transportation, the poor communications, and here, a 5-year program was conducted, but eradication was achieved in 3 years and 6 months and under budget. And then this procedure was used around the world. Brazil became free, Indonesia became free, and finally we were left with 2 foci, one in Southeast Asia, one in East Africa. In Southeast Asia, the amount of transmission of smallpox in India, Pakistan, Bangladesh was unbelievable. And in 1974, in May, one state alone in India, Bihar, reported 1,500 new cases a day. That meant 1,500 new investigations every day. You had to find those people, you had to isolate them, you had to put watch guards at the house in order to vaccinate any visitors. The amount of work was just tremendous, unbelievable, before we had computers in the field or smartphones. And yet, with hundreds of thousands of people working on this, India became totally free of smallpox by the end of 1975. And the last case of smallpox was recorded in Bangladesh in late 1975, the last variola major case. And then the last case of variola minor was recorded in Somalia 2 years later. The person with that case was a hospital employee. He actually got his infection helping a family with 2 small children who had smallpox find the isolation ward. And in that short exchange, he developed smallpox. He had been vaccinated but did not get a take. And now he had smallpox, but no one got smallpox from him. Amazing. Then the people who had worked in smallpox began asking, what are the real lessons that we've learned that could be used elsewhere? And a curriculum has been developed there are hundreds of lessons, but with the 9 specific lessons that are so important. This curriculum is available free at 9lessons.org. And in these 9 lessons, you look at different groups. I classify these as 3 of them that are so obvious. Number 1, that this is a cause and effect world. And if you can figure out the causes, you have a better chance of improving the outcomes. The second one being, know the truth. And I can tell you there are times you don't want to know the truth. When we did our first search in India, which was in the fall of 1973, October, in just 2 states, Bihar and Uttar Pradesh, the searchers in 6 days found 10,000 new cases of smallpox that we did not know existed. And we were overwhelmed in trying to respond. And some people said, don't ever do this again. But of course, you have to do it again because this is the best surveillance you've ever had. But the interesting thing is to go from that to 0 in all of India by May of 1975. And then to have the last case of variola major reported at the end of that year in Bangladesh, and the last case of variola minor reported from East Africa in Somalia. And this is such a remarkable story that we forget it. So then the next 3 lessons, I say, are lessons to step back and be sure we're doing the right thing. The first one is avoid certainty. And a physicist said that certainty is the Achilles heel of science, but it's also the Achilles heel of religion and the Achilles heel of politics. Because once we're certain about something, we don't look for other explanations. We stop looking. But the 5th lesson is how do you measure what you're doing and make the corrections that are necessary? The 6th one being how do you form the right attitude towards the people you're working with? How do you respect culture? Because if you do not respect culture, this will never work. And finally, when you've gone through some of these reservations, you have the last 3 lessons which tell you to go ahead. The first one is combine science and management. Science will give you the best answers. Management will give you the best results. Number 8, get political support. We're totally dependent in public health on political support. And we should figure out how to get politicians invested in the outcomes and not just the appropriations. And finally, number 9, be thinking globally all the time. Every place in the world is both local and global. Any place that you're improving life for anyone, that's global health. So this was a gift to the future that will continue forever, not just a gift for grandchildren, but a gift for children who will not be born for 300 years. They've given us their proxy vote, and they've asked us, please make the right decision. And so WHO can be very proud of this gift that they've given to the future, and they've demonstrated at the same time that they can be great ancestors. Thank you.